Hey guys, Dr. Matt here. I want to touch base on the topic of flying after surgery, okay? So, a little background here. Any surgical intervention carries the risk of developing a clot. And it's because of what happens within the body that drives the body to a pro-inflammatory, pro-clotting state. So, the key, regardless of the situation, is ambulation and activity. The more you move around post-operatively, the more you get back to regular activity, the lower the risk you're going to have a problem. Okay? That being said, we also employ various prophylactic measures post-operatively to further reduce the risk of developing a blood clot. But in all reality, if I had to choose between one of two patients, and the first patient is someone that's local, that gets the surgery and goes home, but just lays about and doesn't walk around, versus patient two, who flies here halfway across the country, but walks aggressively post-operatively and follows all of our recommendations, I think that the lower risk profile patient is the one that's flown here relative to the one that stayed here and just goes home and doesn't move at all. The key here is activity, guys. Our blood clot and our DVT rate is exceptionally low. You can never get it to zero because it's just the nature of a surgical intervention, but ours is exceptionally low, much lower than the national average. But again, it's because we carefully select our patients and we tend to shy away from those who've had a history of clots because we don't want to cause a problem for you. We want someone who's never had a clot, generally healthy, comes out here, follows instructions, employs the measures that we give to them to reduce the risk of clots, and does well. So again, guys, don't worry about it. I worry more about the patient that lives locally, that doesn't move at all, than I do the patient who flies here and is particularly nervous about it, and therefore walks walks so much to mitigate the risk of a clot. So, yes, clot risk is real, but there's ways to reduce that risk further. And if you come with us, rest assured, our DVT and clot rate is so low, don't have anything to worry about. Thanks, guys.